for North Carolina Department of Health and Human Services. Prior to his Chief Health Equity Officer role, Victor served as Director for the NC Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. Prior to his NC State government roles, Victor spent 6 years as Vice President of Behavioral Health for Trillium Health based in Charlotte, North Carolina. And Victor has over 30 years of experience in human services, primarily dedicated to building and strengthening community resources to serve individuals who have been historically marginalized. He is a nationally recognized speaker on issues regarding health equity and access to health care, particularly as it relates to individuals living with mental health challenges. I will turn it over now to Victor.
Thank you so much. Good morning.
Good morning.
Okay, I think I heard this side and part of this side. Y'all must think I don't see y'all back there. Good morning. Okay, all right, much better. So you heard my bio, and I'm going to talk this morning about engaging communities in, first disclosure, this presentation is for educational and informational purposes only, and may not be construed as medical advice. The information is not intended to replace medical advice offered by your provider. What this means is, if I talk to you about suicide prevention, you are not a clinician because I've told you about suicide prevention. This is really to help you to be able to support someone, but it is not intended to be medical advice. So I'm going to talk about addressing suicide at the community level. And you heard about my bio, but what I also am a firm believer, and part of the reason I talk about suicide prevention at the community level is because I believe that the way that we think about our community and who we are and how we identify as a community impacts the way that we think about how suicide prevention, how suicide impacts us. So to tell you a little bit about my background, I grew up in Eastern North Carolina in a very small rural community called Plymouth, North Carolina. Anybody heard of Plymouth, North Carolina? All right. You said you used to live there. Why you say it like that? That you said it like that was triggering or something for you. But you're not wrong. So a lot of what? A lot of growth. Okay, you can talk offline. So, but I was born and raised in Plymouth, North Carolina. Plymouth population of Plymouth is about 3,300 people. So it is very small, very rural. And for those who don't know where Plymouth is, don't worry, half the folk in Plymouth don't know where Plymouth is. So it's really not a big deal. But I grew up the son of a pastor. My father pastored for 48 years in the Church of Christ. He retired from pastoring about 10 years ago. But growing up as the son of a preacher in rural North Carolina, very poor section of North Carolina,